All right, I'm going to go ahead and begin. It is wonderful to see 41 participants on this Atlanta Region virtual meeting. It's wonderful to see all 44 of you now. I feel like I'm on a telethon or something, just counting 46. Anyway, this is an Atlanta Region virtual meeting on telehealth and COVID-19. There's some instructions on the first slide about questions. So feel free to write in your questions in the chat box, and we'll have a moderator. Also need your email addresses so we can email you your certificate of attendance. I would like to start this this meeting by saying Happy OT Month, everyone. And also to begin with the OT Vision 2025. Might sound a little hokey, but we would like for you all to read in unison, read to yourself, but I'm going to just read this because I think it brings us together that OT, as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. So there's been a lot going on. We're all in the midst of things. So we're going to begin with thanking a few people. And Aileen, if you could take that and we can tag team a little bit, but I'd like to introduce Aileen Deogracias, who will tell you a little bit about herself. And also our presenters, when they speak, they will let you know who they are and where they practice. Thank you.
Good evening, everybody. My name is Aileen Deogracias. I am, well, first I'm a mom, I'm a wife. I'm also a pediatric occupational therapist. I am the clinic director at Therapy Works BC. I have a pediatric therapy center. I am also a volunteer for GOTA. I am currently the regulatory and reimbursement chair for GOTA. It is my pleasure to work in this profession, in this position. I would first like to thank the membership. I would like to thank all of the GOTA members, because your membership dues allow us to advocate for our profession here in Georgia. It allows us to have a lobbyist on our side, and it allows us to have a seat at the table for when there are policy changes and regulatory changes. I have been coordinating with the GOTA board, our president, Jennifer Allison, and our past president, Irma Alvarado, as well as Tom Bauer, who is our GOTA's lobbyist. Did I miss anything, Irma? Oh, I've been coordinating, especially through this COVID situation. I have been closely coordinating with the Tri Alliance, which is composed of the physical therapy, composed of members from, or liaisons from the Physical Therapy Association of Georgia, as well as the Georgia Speech and Hearing Association. And we have been coordinating with Medicaid, as well as the care management organizations and the private insurance as well, to ensure coverage for telehealth and allow occupational therapy practitioners to continue to see our patients and continue patient care throughout this healthcare crisis. So did I miss anything, Irma?
I don't think so, other than it's been quite a ride, and we've had several OT, PT contributors and business owners who currently aren't GOTA members, especially the OTs, but I think they'll be back with us very soon. Lots of questions coming around, but definitely we're just full of gratitude and happy to be here talking about this very important subject. Okay. Telehealth, what is it, Aileen?
Okay. I just wanted to give everybody a background of what has been going on behind the scenes for the last 3 weeks. We have been going back and forth with third-party payers ever since we have been on this, ever since the beginning of this healthcare crisis. And eventually clinics have, you know, there are some clinics that have closed, and there are some outpatient therapy providers that have you know, decreased providing services. So, but prior to this, there telehealth, occupational therapy provided through telehealth has already been on the table, and we have had discussions. The coronavirus situation just fast-tracked everything and brought the insurance companies into agreeing to pay for telehealth services. Just kind of to give you a background information. But what is telehealth? What is it? I mean, you know, we've heard the terms telemedicine, telepractice, telerehab, teletherapy, e-health services. But so we looked at AOTA, and we also looked at the Georgia Code, and then our Georgia OT Practice Act. And the unifying definition is that telehealth is the application of evaluative, consultative, preventative, and therapeutic services delivered through information and communication technology. So we are using technology to be able to deliver our service. And the difference with telehealth and in-person service is that there is what you call a distance site and an originating site. So they are now allowing for services where the therapist and the patient do not have to be in the same room. The goal really is for access to healthcare. And prior to all of this, prior to the coronavirus health crisis, the Georgia legislation has passed the Georgia Telehealth Act. And what this is an expansion of the Georgia Telemedicine Act. And it allows for, the goal really is to mitigate geographical location in order for patients to receive healthcare services. With Georgia being a largely rural state, where the availability of doctors and nutritionists and psychologists, and especially occupational therapists and occupational therapy practitioners, the law allows for us to provide services to Georgia citizens in the rural areas. So this was enacted on January the 1st, 2020. And then when did it begin? When the Coronavirus Preparedness and Response Supplemental Appropriations Act was signed into law by President Trump on March 6, 2020. And then what it does is it allows states to broaden their authority to waive limitations on settings where members are eligible to receive telehealth and where telehealth services can be delivered during the emergency. So it kind of just set the stage for us. But if you look at our recent updated Georgia Practice Act, the OT Practice Act, we already have a provision for telehealth in our Practice Act, and it reads it's on number 13 of the Practice Act reads that telehealth means the application of evaluative, consultative, preventative, and therapeutic services delivered through telecommunication and information technologies by a licensed occupational therapy practitioner. So already our scope of practice in our Practice Act allows for occupational therapists to provide this service. So what are the most important aspects of telehealth? First, what we would need is an informed consent for telehealth. On the Georgia Telehealth Manual, it reads that prior to an initial telehealth service, the practitioner who delivers the service to a Georgia Medicaid member shall ensure that the telehealth member consent form is provided to the member and signed. It should be delivered in a manner which the member can understand, using reasonable accommodations when necessary. However, because of the Coronavirus Emergency Act, this written consent has been waived during this emergency period. And on the banner message dated 3/26/2020, it reads that it would allow for verbal consent. And verbal consent is defined as consent to receive services must be provided verbally by the member and noted in the member's file or medical record. Providers are not required to obtain a hard copy of the consent form as noted in the Telehealth Guidance Manual. So during this emergency period, a lot of the requirements around telehealth has been waived. You would also see that on the federal level, and I read the Coronavirus Preparedness and Response Act, CMS, or the Centers for Medicaid and Medicare Services, also came out with the 1135 waiver. And the 1135 waiver states that Medicare can pay for office, hospital, and other visits furnished via telehealth across the country and including in patients' places of residence starting March 6, 2020. However, the 1135 waiver doesn't currently include OT services. So on March 27, 2020, AOTA, APTA, and ASH came out with a joint statement asking for the telehealth expansion to include OT, PT, and speech services. You can find this on the website. So that's on the federal level. Another thing to add on the federal level is the waiver to exclude HIPAA requirements. And it reads that effective immediately, HHS Office for Civil Rights, or the OCR, will exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers that serve patients in good faith through everyday communication technologies such as FaceTime or Skype during the COVID-19 nationwide public health emergency. So this is another waiver that that has been implemented. So that's good to remember. Do you have any questions on the federal level at this point? I know that it's been,
Aileen, I just wanted to, we had one question that came up online that just asked, these definitions that you're reading, are those something that are going to be posted? Are they on the GOTA website, or where's a good place to find this information?
We will post it on the GOTA website. We kind of just put together our PowerPoint presentation, so we will give you those links on GOTA.
Perfect, thank you.
Okay. Yeah. All right. So I'm going to move on to the state level. So as I mentioned earlier, prior to the COVID-19 public health emergency, we already have in place the Georgia Telehealth Act. And the Georgia Telehealth Act is all encompassing, and it covers not just doctors, but also occupational therapy practitioners and clinical psychologists, everybody. And I'm just going to read a couple of important statutes on that, on the Georgia Telehealth Act. And and according to this, each insurer proposing to issue a health benefit policy shall provide coverage for the cost of telehealth, cost of healthcare services provided through telehealth. Another statute is that an insurer shall not exclude a service for coverage solely because the service is provided through telemedicine services and is not provided through in-person consultation. Another statute is that, and this is important because it has to do with reimbursement. This act provides that services provided through telemedicine services should be reimbursed on the same basis and at least at the same rate that the insurer is responsible for coverage for the provision. So it is important to note that when we provide telehealth services, we should expect to get the same rate, or there should be parity in the reimbursement. There's also a statute that says that no insurer shall impose any annual or lifetime dollar maximum on coverage for telemedicine services. And lastly, that an insurer should not require its insureds to use telemedicine services in lieu of in-person consultation or contract. So it gives Georgia citizens a choice between telemedicine or telehealth and in-person consultation. So we have to think of telehealth more as a location rather than an approach or a service whenever we bill it. And this was enacted on January the 1st. And for health benefit policies to be compliant, it should include payment for services that are covered under telemedicine to be in compliance with Georgia law. So one good thing to remember about this, because before all of this, before we were in this situation, the policies or the private insurance policies may not have yet been updated. So when you call the provider line and ask if telehealth or telemedicine is covered, OT through telehealth is covered, they may tell you that they are unable to pay for it. And I'm seeing a question here on the chat box, and this is something that specifically we're going through. I'm going to read it. That Cigna came out with a document saying that they will only pay 2 units of OT per session. Can they do this? Because we provide 4 units per session. And from my understanding of the Telehealth Act, they should not. And because they should not limit the codes, and they should not put any hindrance on how you're delivering your service or you're billing for a CPT code through in-person or telehealth. Okay.
Aileen?
Yes.
I just wanted to, if anybody hasn't seen it, the handout is also linked at the top of the chat box, and resources are hyperlinked. So if you haven't seen it, at the top of the chat box, the handout is there.
Oh, okay.
Thanks, Irma.
All right.
Okay, we'll go through all of the questions later so that we could just continue. Okay, I think I'm doing pretty good. Now we're going to talk about, on the Georgia level, about public insurance. And public insurance includes Medicaid and what we call the care management organizations, which are AmeriGroup, Peach State, WellCare, and CareSource. And so in response to the coronavirus health crisis, the Department of Community Health came out with a banner message on March 18, 2020, addressed to Medicaid and PeachCare for Kids providers. And what this banner message, if you haven't seen it, what this banner message said in summary is that DCH is waiving the telehealth service originating site limitations, and originating sites should include physician and practitioner's office, hospitals, rural health clinics, federally qualified health centers, hospital-based or CAH-based renal dialysis centers, skilled nursing facilities, LEAs or local education authorities, county boards of health, community mental health centers, mobile stroke units, the home of a member, pharmacies, and emergency medical services ambulance. What it means is that the originating site is where the patient is. So they are waiving those limitations and adding these. So you could provide for telehealth services if the member is at home, in a skilled nursing facility, wherever. Now, another important message on this on the banner message is that it will allow for telehealth services to be provided by the provider using the following modalities. So they opened it to telephone communications, use of webcam or other audio and video technology, and video cell phone communication.
No.
So in order for us to provide healthcare access to our members, to our patients, they have allowed for these modalities for us to be able to provide the service, because we are currently at a stay-at-home. I forgot what you call it, at stay-at-home orders. So. And this notification is applicable to all Medicaid and PeachCare for Kids providers, provided the following: that all services must be medically necessary, that we must comply with the telehealth manual posted on GAMIS later on. Just to kind of get back to what was on the banner message dated March 18th, 2020. I was talking about what the banner notification included, and that Medicaid PeachCare for Kids would allow telehealth services under the following guidance: that all services must be medically necessary, and that providers or OT practitioners must comply with the provisions outlined in the telehealth manual posted on GAMIS. There was also a requirement that the patient must initiate service and provide consent to be treated virtually. And the consent must be documented in the medical record with date, time, and consenting responsible party before initiation of the service. Now, I was talking about that banner message dated March 26, 2020, where they waived the written consent requirement and is now allowing for verbal consent. But we have to document on our notes or somewhere with a timestamp that the patient gave a verbal consent. It also, one of the guidance is that the codes that will be billed must be identified as telehealth services by using a telehealth place of service or POS code and or a telehealth modifier, GT or 95. So this was something that has been in question because although the POS or the POS code, which is the 02 code, we are getting reimbursed for, there's still a little bit of difficulty with getting the systems to recognize the modifiers. So it is a work in progress. And lastly, that qualified healthcare providers must continue to comply with state telehealth laws and regulations, including professional licensure, scope of practice, standards of care, patient consent, and other payment requirements stated in the Medicaid PeachCare for Kids policy manuals. So all those rules still apply. The only difference is that we are billing a different POS or place of service code and may require a modifier code. In that banner message, there's also a portion that states that home and community-based waiver service providers, which include home health, can provide telehealth in lieu of face-to-face visits when performing initial and annual assessments, as well as level of care determinations. Case management services, nurse supervisory visits, and assessments for home care admissions may also be provided via telehealth. I posed this question to our home health care providers and just wanted to ask how this has been, if they are able to bill for these services via telehealth, because we all have to think that yes, they allowed for telehealth services, but the billing systems or the reimbursement systems are still catching up with us. So you may get denied for telehealth visits at this point, but that's not to say that it won't get paid, because you do have the banner message and that assurance that they are going to be paying for these services. Are there any questions at this point? Just put all of your questions in the chat box and we're going to go over them. I'm gonna go to private and commercial or commercial health insurers, and these are the policies under Cigna, Blue Cross Blue Shield, Anthem, Humana, Kaiser, and others. So coverage for OT services via teletherapy varies from plan to plan, even within the same insurer. This is what we're finding out. So just because they're Cigna doesn't mean that they are covering for teletherapy services. Therefore, we are not putting out specific info on private insurers, as we do not want to give out incorrect information. We are leaving this up to providers to call each individual insurance company and ask for coverage of telehealth service. However, as I was talking about earlier, the Georgia Telehealth Act is in place, but only came into effect January the 1st. So the policies may not have been updated yet to reflect this. This is the part where we as provider advocates may have to inform them that, you're saying that it's not covered, but the plan may not be in compliance with Georgia law. Because you cite the Georgia Telehealth Act, and when you give them that information, they may reconsider, or they may rethink, because they do want to be compliant with Georgia law. I would like to ask our members that if you do experience that they're saying straight that we're not covering it, and you made them aware of the Georgia Telehealth, well, let us know, because we may want to put together a statement against that particular insurance company. So, and it can be done through the Office of the Insurance Commissioner. So we can file a complaint, or you as a provider can file a complaint. And I'm encouraging you to do that, because you are advocating not just for your profession, but also for your patients, so that they can have access to healthcare services. And these premiums, they've already paid for these premiums. So it is unfair for them not to be able to continue to receive service, especially if it's already pre-authorized and you have a plan of care going. You may want to take it another step. That's it for my portion. And now we're going to be talking about specific practice areas. And I'm going to give an update later on CIS services. Irma?
Right. Yes, I'm going to talk about early intervention. The nice thing is that early intervention in Georgia, as you know, we're a state where there's a lot of people who have access issues. So we started a pilot in North Georgia and South Georgia back in February. The platform that early intervention is using, or Babies Can't Wait in Georgia, is WebEx. There have been trainings, but let me tell you, when this all started about 2 weeks ago, it just snowballed. So now Babies Can't Wait providers are being trained in how to use the WebEx platform and the steps, which I won't go into because they're pretty generic about you can get verbal consent, you know, teach your the parents or your caregivers the front load it with teaching them about the platform and do some things to set the stage, if you will. But so I'm going to leave that one there, but the billing and the modifiers are just as Aileen has said before. One thing that is very, that we all have to do is if any of your clients have access issues, because what happens is if you're in a very, very rural place, you may not have access to internet, so people would have to use their telephone minutes, and some people don't have unlimited plans. So we're trying to find ways to document that, because our legislators need to know that, so that internet can be provided to some of these areas. But that we're working very hard to just get on FaceTime or Skype, or find another platform, which is really nice that they've waived those restrictions, regulations. There is good news in that, you know, speech therapy is getting paid, and then the OT and PT is ramping up as the systems place their codes in and change their systems for telehealth. The nice news that we got too was that some claims for OT and PT are coming back suspended, and that just means that the CISS system is holding those claims and will be paying them once they get their systems up to recognize those codes and that type of billing. That's really all I have for Babies Can't Wait for right now, and I think we're going to get more questions as we move in. So Aileen, do you want to pick up that part about the CIS, and then we can move on to school services and Chrissy's portion?
Yes. So for outpatient peds, and this is services provided through Children's Intervention Services, or CIS. Like I said, the Tri-Alliance has been closely coordinating with DCH, Medicaid, and representatives from each care management organization. And they have indicated in writing and now through provider communications that they will allow for payment of telehealth service of OT, PT, and speech services via telehealth. However, like Irma said, you know, yesterday, the CIS manual has been updated to include the teletherapy billing codes, and all therapy codes currently listed in the CIS manual will be covered during this special period of time by all these entities. Again, but however, because the better message is in place, so we have the go-ahead beginning March 18, 2020, but you may experience difficulties with billing because the billing systems do not reflect it yet. I know that telehealth OT services via telehealth provided last week did not get paid at all. And yesterday, the 31st, they did not get paid, but there were payments for PT and OT services today, but that was just a place of service change, and they did not include the modifier. So you may want to try and put in a claim using one with a modifier and one without a modifier, and see see what works and see what gets fixed, because it really is, it's really a systems overhaul for them. So they are asking for your patience. But I know during these times, you know, we definitely need that reimbursement, as a lot, or a majority, I think, are not doing face-to-face visits and are transitioning to telehealth. But yeah, that's my update from CISS.
Gail, are you on the call?
Gail on the call.
I don't think she is, but I'm going to move through her information. Aileen, if I forget anything, let me know, and then we'll pick up with Chrissy and then begin to wrap up, because I think there's a lot of questions, as we would have predicted. As far as school-based children's intervention school service, or CISS, we've been talking with Gail Lindsay of Fulton Schools and Hillary Lamar of the DeKalb County Schools. And as you all know, the schools are on hold and shut down at the moment. They will probably not even come back to school, as we're getting more and more information day to day. All the students that are on record as having an IEP are getting teletherapy if, as I said, the parents have the internet access, and basically they're hosting meetings to determine service times and conducting their IEPs, which they updated all their IEPs on February 28th, and I believe that's for Fulton. They're really getting innovative with things called choice boards, that they're putting together packets, and the school systems, as you know, already have a fairly good internet system in terms of how they communicate with families. Let's see, one more thing. Their issues happen to be that they're with giving the standardized assessments and evaluations, but they seem to be working through that fairly well. But that would be the problem that they're anticipating here. That's really all I have, from the school system. But we definitely will be getting links from Gail and Hillary and putting them on our GOTA webpage, should you happen to be school system therapists, and they will be your resources.
Irmo, it's probably good to mention that they are not using teletherapy at all in the schools, and that they are currently providing the choice boards would kind of, it's like home program, from my understanding, that that they give to the families when they are given their meals. So I think the bus delivers the meals, and then the OTs have been adding, choice boards with the meals, just to provide for activities so that the parents can continue to help address IEP goals. So they would have pre-writing choices or sensory choices, or, so they said that the 60 OTs in Fulton County have all come together and just come up with this program, which they have made available on the Department of Education website for all school-based OT. So they are sharing that with you.
Right. Aileen, they did give us the link, didn't they? So if not, we can get the link from them and post it on the GOTA page.
We'll post that.
Right.
And Miley was saying that school systems are also utilizing Google Classroom to offer activities for OT. So that's good to know.
What classroom? I'm sorry.
Google Classroom.
Google Classroom. Okay.
Mm-hmm.
Well, with that, Chrissy, what do you have to tell us?
Well, I want to be real respectful of time. Being you guys know my second life. I'm a professor, and I know students turn into pumpkins at the end of class time. So I'm going to breeze through this, and Irma will share with you guys my information to ask me any further questions. I am Senior Vice President of Clinical Services for Upstream Rehabilitation. We provide all of the benchmark outpatient clinics in Dreher. We've got about 800 clinics nationwide, and we launched this program 10 days ago. We started out with 7 on that first day in Kentucky when the governor shut things down. And as of today, we did 501, I believe, and I've got 2,000 on the books coming up within the next week. So explosive growth in teletherapy. We've learned a ton just in the time that we've done. Aileen did cover a lot of it. The big thing is the place of service and the modifiers, and we did kind of work our EMR system to do some of that stuff automatically, which was super nice. In terms of payment, we are seeing payment from multiple commercial resources, and you do have to check those contracts, as Aileen said, because everyone's is different. And some people are limiting the number of codes and saying we're only going to pay for 2. Whether they can do that or not, we can fight that, but they are limiting the number of codes that they're saying that we do, but by and large, they've been really good about it. We are starting to get payments in from those first couple of days. We've seen about 60% pay us. We've seen about 30% deny, and they're denying because we did not have the correct modifier when we actually did. So again, I think it's a systems problem. We had really good reimbursement from TRICARE. It's done a really good job with us. I'm going to encourage you guys, if you would, I'm going to have a shameless plug here. Please get on Twitter. Follow me on Twitter at Chrissy Probert. I am trying to stay in the throes of with Medicare. You might see me get a little sassy on Twitter, and I apologize for that. But Medicare approved our codes, our CPT codes, to be reimbursable. Occupational therapy, evaluations, PT, SLP, and our services, but then turned around and said that we're not qualified providers for telehealth. So I don't know who they think is going to provide occupational therapy besides occupational therapists. So please join the fight. Get on there, tweet, retweet. We are in alliance with APTA, APTQI, AOTA, ASHT, ASHA. All of us are trying to join together to really pressure Medicare under the 1135 waiver to get the secretary to sign to make us providers. So help us and join that fight, and know that our seniors do deserve that. So we're battling that with our older adult population. I am not involved in home health, but I imagine that a lot of you guys are going to see those barriers from those federal reimbursers, from Medicare, also access that a lot of our home health patients might not have in terms of internet access. But it's working well for us so far. We are using Ring Central, which is a white label Zoom product. And there's nothing really magical about teletherapy. Just really keep in mind that it's a video conference followed by documentation in your system of the right stuff. And it's a one-on-one connection with patients. They're tending to really love it. We have created a website where they can go on and order equipment and have it delivered straight to their house. So that might be something that you guys can work out. Even some Amazon, commonly used Amazon stuff in treatment that you might can send the code to your patient. So just try to think outside of the box and keep people safe. And again, it's my email address, Jennifer. Irma, if you'll just share my email address with the crowd, I'm more than happy to answer any questions in that outpatient world that you may have.
Chrissy, is it the email address at Bernal.edu that you want me to share? Okay.
Yeah, kprobert at
Kristen has it. Yeah.
Yeah. Hey, okay. Kathy. Thanks, guys.
Yeah. Chrissy, could you just say, repeat, what platform did you say you were using?
We're using Ring Central. So
Ring Central.
Ring Central. It's a white label product from Zoom. And as you know, the government did lift the HIPAA qualification, or requirements for us. So we're able to use that now. But I'm going to tell you, now that this is rolled out and Georgia already has the infrastructure in place for telehealth to continue and for us to have that parity in payment, I think our therapists are really going to love this, get used to it. And I foresee a hybrid model of this being used in the future. So I think it behooves us as professionals to get ahead of the curve, to learn what we can, and then be thinking long term that we're going to need to go to a platform that is secure on both ends. What would that look like? And don't get caught up in these systems that they're going to try to sell you that are super fancy and have all kinds of bells and whistles and create documentation. If you've already got a great documentation system, you just need something that host a video conference well. That's it. So don't get caught up in the sales hype that folks are trying to take advantage of right now.
Good advice. Good advice. Aileen, can we wrap with reimbursement, billing, documentation, and those points, and then get to our Q&A, which I think, again, it's there.
Okay. And that's me again, right? Okay. Oh, reimbursement and billing, and we talked about this earlier. You have to bill using the appropriate timed CPT code. So you are still billing for 97530, 97535, 97110, 97112. But then the difference is that you need to identify that that service was provided by a telehealth using that 02 place of service code. So in outpatient, if it's an office visit, we bill an 11 code. So some EMR systems are already have a default for an office visit or home visit, which is a 12. So you may want to go and look at that and see if your EMR has reflects that teletherapy place of service, and or use a modifier code, which is GT or 95. And you have to follow each insurance company's billing policy, because it may change. It is not, we're finding out that it is not uniform for all insurance companies. They may have different ways of identifying it, but you have to follow the directive. And if that directive, just like Chrissy said, if they are not paying, you can ask them to reprocess it, but you need to have the documentation with you, like what is on the policy manual, where does it say, or looking at the what do you call that, the banner messages, because those are your proof. That really is it. It is proof that this is going to be covered. And I mentioned about that at this point, April the 2nd, not all claims for OT via telehealth has been billed. Documentation, we're gonna go quickly through documentation, and then maybe Irma, you and I can talk about this. But just like Chrissy said, you know, we have, there is nothing really different, but with this, but we have to document, we have to demonstrate, articulate, and communicate our distinct value as OT practitioners. We have to show how OT helps, especially now that we are in the home. You know, for us pediatric therapy providers, we sort of simulate the home environment based on what the parent tells us. And now our first visit would involve, like, you know, telling them that, you know, thank you for welcoming me into your home. Would you like to show me around and show me what toys we can use, or what is it, or asking the parent, what is it that you're having difficulty with at home that we can address during our session. And that in itself is showing parent participation or parent partnership and coaching. What we can't provide directly, we have to be able to communicate and teach to our parents, because they are the hands on the other side of that screen, you know, kind of just thinking about that. The documentation requirements that Medicaid has, the documenting within 3 business days or within 72 hours, that still applies. Writing about what happened during the activity. You know, you have to talk about, like, you know, I provided my first teletherapy session. I had to walk the parent through Zoom or GoToMeeting, you know, just so that we are able to get in touch and communicate with each other for the next visit. And you may have to do that with your adult patients. You know, I taught them how to download, you know, the program that I needed, or it can be, you know, like we talked via FaceTime or we talked via Skype. you have to describe the context. What did you do? What did you address? Where did you address it? And give feedback from the patient or the caregiver, like, telling them like, wow, this is difficult. Therapy is not easy. And you have to talk about that. You have to show our distinct values, show what we did, and painting that picture is not always perfect, but we have to show it, and then having a plan. I guess one of the feedback is like, you just can't jump into a session and grab whatever toys you have. You may have to plan ahead and use your plan of care, just like teachers have a teaching plan. A lesson plan. You have to have a care plan, and you have to prepare your home program that you can send through the chat box via PDF ahead of time. You may need to practice, help the patient access what you're sharing via the screen. How do you annotate? How do you allow them to have access to the platform? So those ingredients are very important, but you have to show that you instructed the caregiver and instructed the patient and made it, a true session where they
Right.
made a lot more value.
As Chrissy was saying, nothing has changed except, documenting what you do. And this is really a turning point for us in terms of accountability and getting that across. And it's really a good time to practice this way. There will be some important links. For example, AOTA has a great link on writing pediatric goals, how to document family involvement and developmental progress. So things are there, and we will upload those links. I'd like to go ahead and, before we finish, the telehealth platforms. Oh, and also did want to mention something that Chrissy was talking about on the electronic medical record, or EMR. You're paying for this service. So for example, we use Clinic Source, and they had put that telehealth visit on there. So now we can just click on that. And you still need the point of service, but it's nice to see that you've got, office, home, telehealth there. So you're a consumer of these products, so get them to get what you need so you can get that documented. In terms of telehealth platforms, as we said, we've gone over all the different kinds, and we're interested to know which ones you're using. But Aileen, I don't think there's too much there other than us. Everyone knows you've got WebEx, GoToMeeting, Zoom, DocSeeMe, and then all the others from FaceTime to Skype and Google Hangouts. So
Yes,
it's up to you and your client. Go ahead, Aileen.
But if you are going to use a particular platform, there are things that you may need to take a look at. You want to look at HIPAA compliance, even if it was waived. Best practice still dictates that the platform that you're using is HIPAA compliant as much as you can, as much as you are able to provide it. You want to have audio video capability. You want to have ease of use for patients and the therapist. You don't want it to be too complicated that they're going to say like, no, I don't want to do teletherapy. It's too hard. You may want to have the screen share capability. And this is true for those that are practicing in school-based OTs, because that would allow you to be able to complete worksheets or color or do or participate in games that that you both can manipulate. A chat just like, Zoom has a chat option. That's always good because it is an easy way for you to share files and share home programs with the families or with your client directly.
And Aileen, I just want to interject here that the DoxyMe right there is DOXY.me. I call attention to that because that's a really good platform. And one of the things it allows you to do, it is free to use for one patient, one therapist use. And you can sign a BAA on that. So it does have a BAA
perfect.
you can download individually as you're performing that. So it's DOXY.me, doxy.me. So
I'm typing it on the chat box.
there you go.
Oh,
there you go. Doxy.
They're fixing it for us.
.me.
Yeah. Eileen, let's go ahead and start wrapping because I'm looking at 8:48 and then get those Q&As. And I think that people's questions will be about things to consider, how to manage things. So are you okay with us going through that?
Let's go ahead. Do you want to go and talk about the number 7 things to consider?
Basically, we've talked about setting the stage, front loading, providing that plan of care it's the client's document anyway, and it's a good way for at least caregivers and parents to say, oh, this is what that OT does, and how can I do this at home? So that's a very good idea. And don't forget about your occupational profile. That template is in AOTA, and that's a good way to say, tell me about your day. That helps you organize that. Let's use what we have that identifies us as OTs. I'm going to leave it at that.
The PEO model and the MOHO, it's perfect for us occupational therapists to kind of revisit that again, because it allows us to actually be in the patient's environment and actually see what they're going through and how we can intervene and how their occupation is affected by the disability. So I really would like to push for us to use known OT theories and let's use this opportunity to sell our profession and to put our profession in the forefront of during this crisis. There's a lot of opportunities for us OTs. We were talking about how you schedule and manage your caseload. Some OTs recommend about 6 per day. Depending on how long each session is. Some sessions may only be 30 minutes. Some sessions may be an hour, depending on how long you need to do. In pediatrics, we've been doing maybe 30 minutes to about 45 minutes, and then as the families are getting more used to the program, we are able to address more issues. So we have been, doing about 30 to 45 to 60-minute visits. Especially for peds, we're finding out that some of these families don't have the appropriate toys. It's as basic as that. And this has been a great opportunity for the therapists to use recyclable materials and create toys in the home, or look at opportunities for, like what are a good fine motor activities that are within what they're doing already. They've been looking at, including the child in meal preparations, in family routines, in looking at different activities. These parents are at home just like us, and they're all looking for opportunities to other things to do. So, our teletherapy sessions have been welcome relief, I guess, from homeschooling is
correct. And basically for the routine that everyone will get back to, or not, in terms of telehealth or coming back to clinic. Aileen, did you want to talk about that webinar before we get to the questions, or is that going to be posted about these Georgia Medicaid webinars?
Yes, we will be posting a link. I just saw that there was a banner message yesterday that Georgia Medicaid is offering 5 webinars, and you can attend at least one on telehealth. And this will be on April the 9th at 9:30 a.m., April the 10th at 11, April 13 at 1, April 16 at 3, and April 20 at 9:30. We'll post this, so just wanted to let you know. And there's a Google form that you need to fill out to sign up.
All right.
Right.
Now,
Right. Woo.
questions.
I've been compiling some of the questions, so I can trying to group those together so I can go over those if we're ready for that.
We are ready.
So there's been a lot of talk about telehealth and home health. It seems that that hasn't been a utilized service from the people that I've been writing in who work in home health. And Rebecca brought up a good point about, she has several statistics in the chat about older adults and their access to technology and internet services, and how to address that with the home health companies that people may be working for. Anybody have experience
Or
with
I
that
mean,
so far?
Okay.
Yeah, it's like I mentioned earlier, it's kind of an enigma right now. It's, you know, how do you provide telehealth services to people that don't have access, as Irma said, you know, even if they have a cell phone, which most of them do, there are limited minutes, or they don't have internet access. That makes it really difficult. And then with home health, sometimes the care need is so great, you know, it's very difficult to find that those patients are even appropriate at this point for intervention via telehealth. So, you know, I'll be honest, I don't know. I think that those of you that begin to pioneer in this field can lead us there and give suggestions, but I'm stumped right now myself as well.
I think Charlie may have something, or but again, telehealth isn't for everyone, and if it's not appropriate, guys, it's not appropriate. But if it is, you know, and the cell phone is going around the house, show me what the bathroom looks like. Okay, where are you? What do you do? You know, that kind of thing. Charlie, you're nodding your head. You could help me with this if you want, but just unmute your mic. But that's it. You don't have to invent anything new. If it works, and this is the perfect context, because that's where that person
Yes,
is.
Irma, this is a great time for OTs because we have that skill and ability to have people thrive where they're at. And since everyone's at home, you know, to try and set up that environment so whether they're children or adults where they can really thrive. So we're entering springtime now. Great opportunity to start some tomato plants or start some gardening activities, you know, for people that have that idle time. It's really good for range of motion and balance and so forth. So you can set that up so they can do things according to their ability. So, you know, and then, you know, set your goals in that.
Right.
But you might want to also, like, you know, Irma just said, is sometimes if you know you're going to plan an activity, maybe notify the caregivers beforehand to set up that environment. So if you want to do some gardening, maybe they can set up a table or something in the garage or on the back porch, back deck, you know, so that when you join the activity, you can get started. So there might be a little bit of preparation needed to set up the activities.
Exactly. And this is the opportune time for that caregiver to know they can do it and be encouraged to take care of that person and do what they want to do.
And it's nurturing, and this is just again a great time. I think we're going to really you know, we're going to be better for this, you know, when we're done.
Okay.
Another question we had is in regards to COTAs providing telehealth therapy, and what are the requirements in the state of Georgia for that?
And I'd like to answer that, Irma, if that, if I may. Currently in Georgia, occupational therapy assistants, physical therapy assistants, and speech aides or assistants are unable to provide services through Children's Intervention Services. So that rule still applies. It doesn't change. It's not our preference. It's not something that we are in agreement with, but for if you are billing through Medicaid and PeachCare for Kids or the CMOs, you are unable to bill for COTAs at the moment.
Chrissy, anything on the adult side about COTAs, LPTAs?
Same thing, Practice Act, is kind of tricky when it comes to that. I think right now we've limited it to just therapists at this point, because if there's supervision requirements, how do you document those sort of things? So I think it is tricky, a brand new area for us. And again, we're learning. We're just advising all of our folks to follow their Practice Acts as closely as they can in those regards. So.
Yeah, definitely a goal for us, though. Does anyone have any input on that? Anybody else? Because if you have something to say or to answer, go ahead. But if not, we'll stay with our questions.
I would just say that it's important to look at the position paper on the standards of supervision that AOTA has, and just really look at that closely as an OT to know how to supervise a COTA in that kind of a situation. It may not be spelled out specifically, but if that individual is billing private insurance, that certainly is, from an ethical perspective, something that you would want to really dive into and make sure you're meeting all those requirements.
Correct. And I'm really think it's a shame that we don't have a school system. But so if anyone's out there from school system, COTAs are employed in school systems. So if you've got any input about how they're handling that, that's appreciated.
This is Miley. I had one of my questions on that chat I put on was about school system. I didn't relate it back to telehealth very well, but I meant to. So in one of the schools, well, both of the school systems we're in, they're not allowing us to do any telehealth or video chat or anything like that with the students. And so, of course, the concern is we're not following the IEP. They're not being fulfilled. I understand we're in a pandemic. I mean, we're in a very unusual situation, but also wanting to make sure we're doing what we need to do. And so one school system has been advised to upload things to Google Classroom, and I have 2 COTAs in one of the school systems that I supervise. And so I'm still weekly checking in with them to make sure they're following through. So supervision wise, because they're continued to be paid by the school system. And as I understand, we need to provide supervision if we're an OT over COTAs. But at the same time, I don't feel like the IEP is being fulfilled. So.
Yeah. Yes. And that's a legal document.
Right. And Miley, thank you for speaking about that, because we did ask that question. We did post that question to Gail, right, Irma, about the compliance with the IEP, and and there are a lot of school-based OTs nationwide that are concerned about having to provide comp time later on for service that was not provided. So there has been talk about just suspending the IEP process, which is or special IDEA, but that's now a violation of our students' rights to access the educational environment. So there's a lot of moving parts, but it really is up to us to advocate and to show our value. And I'm, it concerns me that, that you have that technology and you are able to reach the student, but why are they not allowing it? I guess it's because, if you have to give it to one, you have to give it to all. So there's so many,
yeah, and a lot of the students, or some of the students may not have internet access at home, which even in that case, they're not accessing the Google Documents or Google Classroom, and which then, of course, goes into learning, and they're not, so they're really not accessing, I don't know what. So it's a problem all the way around. And, I'm just trying to be as flexible as possible, but it's hard to watch them not get services.
Correct. It'll be very good when the accounting comes to fore, when we calm down, but keep a good record of this, and it's going to come back. Parents are be very serious about that IEP. So keep some good documentation on that. Other questions here?
There's an additional question on what are the requirements for telehealth in the public school system? Is consent required?
I am not currently in the school system, so I can't speak to that. But it's always best practice to have consent. Is my answer across the board.
Yes, and I haven't seen anything written as to is that required, but absolutely, I would always use best practice and get consent because, with my clinic, I know they alleviated a lot of the HIPAA requirements and restrictions, but I absolutely will not use something that's not HIPAA compliant.
Right.
So I would suggest the same thing within the school system. I mean, it's information, it's kids' names, it's part of their documentation. And so I would just be really careful and always get consent.
Right. We should treat it all the same, whether it's a medical record or it's the same. We do our best to document that. We could pose that question to Gail and to Hillary too, and get answers to some of the things we cannot answer fully here. Okay.
There's another question about level 2, any changes regarding level 2 students participating in telehealth?
Chrissy, we are currently just listening to ACOT, dealing with, stay-at-home orders, shelter-in-place systems, regulations that are impacting the level 2 fieldworks right now. However, they will be, the students' level 2 fieldwork will be fulfilled so they can meet their requirements. It's just the adjustment right now and trying to, of course, above all else, be safe, keep the students safe, and I think it's more to come from that. I know fieldwork educators are working very hard right now to get this figured out.
Yeah, I was just going to say that it would be important for the fieldwork educators to check with the students' fieldwork coordinators, because they have all been very involved in meetings with Neil Harbison at AOTA, and they're trying to answer those questions. And AOTA actually has a dedicated page on their website that is answering questions about everything that's going on with COVID-19. And so you may be able to find some answers to your questions there as well. But probably the most direct link to your answer would be through the fieldwork coordinator at the school.
Correct. Okay.
Sorry, forgot to unmute myself. We have several other questions, but I know we're kind of hitting our time limit at this point. Is that something you guys want me to just save these questions and we can answer them via the website?
I think that would be a very good idea. We've all been working hard, and I think one of the things about telehealth is, wow, doesn't it keep you busy all day long? So that said, I think just want to close. Aileen, if you want to say anything, but I do want to say thank you to all of you. We will have more of these town hall meetings. This is GOTA. We are here, for you. So thank you, Aileen.
And thank you, everybody, for hanging in there with us. We will try and answer these questions even after the recording. So we'll just try and respond to them. And I guess my advice is just be patient. Let's all, we are doing the best we can in a situation that is, the word unprecedented is so overused these days, but it is, and we are we're in a position where we've never been before, and we have to find ourselves in this situation. But I feel like there is a lot of opportunities for us OTs, and we are at a point of maybe redefining the way we deliver our practice.
Definitely.
So I appreciate you even being willing to learn about telehealth. And even because it does open a whole new world for those that want to thrive in this place of service. I don't think I am for telehealth. I miss my patients. I miss being hands-on with them. But this allows us to serve some rather than serving none at all. We are in that position. We could have been just staying at home and not providing therapy, but this allowed us to see some of our patients. So,
what we'll do is, we would definitely want to thank Kelsey and Kristen. They're going to help us get these questions together. Is there any final instruction from any of you guys on anything? You'll get your CE certificates, and we'll get these questions and we'll post them. I think you all will have noticed that the GOTA webpage is fantastic. Check it out. There's some very good things there.